Take a second and think about the physical act of singing. Think about the parts of your body that help make the sounds and the words. Some are pretty straightforward, your lungs, your mouth, and so on, but I bet there's more than you anticipated. Hi, I'm LeAnn, and I'm one of the instructors at Region Buzz in Northwest Indiana. I teach beginner piano, guitar, and voice lessons, and have happily made the studio my home for over 2 years now. Today, I want to take a few minutes and talk about vocal anatomy. Singing is a full body activity. This statement was gospel at the music school that I attended for college. Sure, it makes sense when you go to a concert or you see a band at a festival. Everyone is moving around a stage performing, but there's so many moving parts within our bodies that allow us to make sound. We're going to start on our lower bodies and work our way up. Place your hands on your belly and try to feel where your rib cage starts to open and split. That's where our diaphragm sits. Our diaphragm is this huge muscle that helps us breathe. You've probably heard people saying, breathe from your diaphragm. It's an extremely important part of our body, and we have to strengthen it to sing properly. I'm planning on making another video specifically about the diaphragm, so watch for that. Moving up, we have our lungs. Most of us have learned from an early age that our lungs inflate with oxygen and deflate with carbon dioxide. We need air to breathe, and we need air to make sound. Attached to our lungs, we have our bronchi, which are attached to our windpipe or our trachea. Sitting at the top of our trachea, we have the larynx. Some people are able to see it from the outside. It's your Adam's apple. The larynx houses our vocal folds or vocal cords. Both are used interchangeably. Our vocal cords are extremely delicate pieces of tissue about the size of your thumbnails. Sound is created when we talk or sing or laugh by air passing between these tissues. It's similar to using a reed to play a saxophone or a clarinet. They close together when we change pitch, and the muscles, the ligaments, and the cartilage, they surround and they shift as well. When we sing higher, they lengthen and they become thinner. When we sing lower, they become thicker and they shorten. Inside our mouth and our faces, we have different structures to help with resonance. Resonance relates to the quality of sound waves. When we open our mouth and sounds come out, the space inside acts as a resonator, or it reinforces the sound by allowing waves to bounce around it. Depending on the shape we have inside of our mouths and how our lips are moving on the outside, we can change the quality, volume, and pitch accuracy of our tone. Inside our mouths, we can lift our soft palate to allow for more space when we breathe. The soft palate is that fleshy part in the back of our throats where our uvulas hang, that punching bag looking thing. Our hard palate, the roof of our mouths, is closer to our teeth, and it also affects resonance. Even our sinus cavities and our cheeks can have an effect. Think about how stuffed up and nasally you sound when you have a cold or a bad allergy day. Part of that is because there's less room for sound waves to ricochet through our sinuses due to inflammation and excess mucus. To finish off our crash course in vocal anatomy, we have the articulators. These are your lips, your teeth, hard palate, and tongue. We use these parts of our body to form syllables for words and give our performances a verbal meaning. The ability to sing, speak, yell, laugh, grunt, communicate using speech and sound in general is an incredible thing that our bodies can do. Vocal training helps us get all these parts in sync with one another so that we can use our muscles, air, and bodies in an efficient, healthy way. At Region Buzz, we'd love to help you do that, whether it's voice lessons or another instrument like guitar, bass, drums, strings, or more. Follow us on Facebook and Instagram, check out our content on YouTube, and keep creating, friends.